Oftentimes, patients over-obsess about nasolabial folds. These folds that run from the corner of the nose, past the corner of the mouth, and oftentimes downward. Even little children have nasolabial folds, but what we really want to do is to keep them confined to the upper third of the fold. And that's a natural, youthful look. Very few of us are blessed with no nasolabial fold. And in fact, people with no nasolabial folds oftentimes have no anterior cheeks or tend to have a very flat look here. So you win some and you lose some. You can't have everything, right? So people will say, well, I want to get a facelift to help the nasolabial fold. Well, the fact that there are so many different types of traditional facelifts, those facelifts with an incision in and around and behind the ear, reflect the fact that none of them are 100% successful in all patients. That's why they have so many of them. For example, there's only one appendectomy. Why? Because it works. There's only one wheel shape. Why? Because it works. Why are there so many different facelifts? Because they don't all work uniformly, consistent. So a good plastic surgeon who knows their facial anatomy and are good at facelifts, those who know how to be suitably aggressive and suitably soft, know that they can all get very good necks, good defined jawlines, help the jowls, but the area that is the most inconsistent, the most vexatious is the nasolabial fold. That's why there are so many different types of traditional facelifts. As I was mentioning, those ones with the incision inside and around and behind the ear. So whether they're a deep plane facelift, a compound facelift, a Weissmass facelift, 3D facelift, high smash, low smash, skin only, the problem is that none of them are 100% successful at treating the nasolabial folds. And that's why the real challenge for these facelifts is there's a new facelift all the time. It's another attempt to help the nasolabial folds. People then started doing endoscopic mid-facelifts, and when they first came out 20 years ago, people were saying, well, they'll be great for the nasolabial folds. No, they aren't. They're great at creating beautiful faces. They're a glamorizing procedure. I find that the elasticum facelift is very effective at treating the nasolabial folds. I've had a recent patient that was saying, well, I really expected it all to be gone. Well, they still had an amazing result, and their nasolabial fold is confined to the upper third. Now you can see here, as we get older, the fold gets a bit longer. So the ideal look is something like this. But to have this completely ablated is being unrealistic. So I hope this helps. Some patients, after having had a facelift, they still are obsessed in their quest to eradicate the nasolabial fold. So oftentimes we'll do other measures such as microliposuction. Sometimes helps, sometimes doesn't. Putting filler into that nasolabial fold, or actually in the triangular hollow below that. Take your pick, whether it's a temporary filler such as a Juvederm or a Restylane or Radius variety, or a more permanent one such as Belafil or fat. Remember, fat is a filler, it's a living one. So these are all that are done to help eradicate or smooth out the nasolabial folds. But if you're thinking you're going to get rid of them completely, give yourself a break, chill out, because it's almost impossible. And number two, it's not natural.